Thank you, Anne. I'm going to speak very quickly, and I wanted to just say how wonderful this meeting has been. Jose, what a great talk, and Hans, I thought this was fantastic, and people before. There was too much material for me to give, so I really cut a huge amount out. I'm going to focus in on only one thing, and that is the last year and a half we've been trying to set up clinical trials in China to test a cell transplant and drug therapy combination in spinal cord injury, what it took, what are the obstacles, and what it means from the viewpoint of the United States. And I use this provocative title, is the cure for spinal cord injury in China? And the answer is, of course, not yet. First, my wife complained awful about this font, so I apologize for the font to begin with. But anyway, basically, it's meant to remind me of certain things to say. But the incidence of spinal cord injury is enormous in China, and it's been increasing. In the 1980s, it was 5.4 cases per million. 1995 was shown to be somewhere between 6.7 to 13.7 cases per million, and then in an unpublished study in 2005, the incidence has been documented to be 64 cases per million, and this translates to approximately 80,000, more than 80,000 cases per year in China. And for comparison, the incidence in the United States is 35 cases per million. About 10,000. So they have close to 8 times more spinal cord injuries, absolute number, than we do, and they have more than twice per population than we do, and it's a very scary number. The prevalence is not known, but I just made a rough back of the envelope guess as to what it is. I assume that there were 250,000 people with spinal cord injury in China in 1990. And I assume that the incidence went from 6 to 60 over the last 15 years, and that the incidence, the survival was 90%, and then there were 2% annual mortality rates. And given that, I came up with a number like 600,000 people with spinal cord injury. And if you continued this extrapolation, it goes up to about 1 million in the year 2020. So this, I estimate, would be approximately 1/3 of the world population of spinal cord injury. So China has a very significant spinal cord injury problem. And by the way, this is just spinal cord injury. You do it for head injury, you do it for everything else. They have a big problem. It's bigger than anywhere else in the whole world. They need clinical trials more than anybody else. And by the way, they know and understand this. Spinal cord injury care in China is very limited, in part because and I will talk a little bit more about it, the medical care system has been transforming very rapidly at a pace that you cannot believe. But in acute care, they do bony decompression, stabilization, like here, but one difference is that they do laminectomies on almost every patient. It's just routine. If they operate on the patient, they do a laminectomy. And very frequently they do a front and anterior fixation. They flip the patient over, do a laminectomy. I mean, they would do both sides, and it's on a routine basis. They do it without second thinking about it. They just do it. They do it so fast it's unbelievable. The typical spinal surgeon in China operates on 400 cases a year. And they have so much more experience operating, there's no comparison. No U.S. surgeon has anywhere close to the kind of experience that the average spinal neurosurgeon or orthopedic surgeon in China has. Rehabilitation is almost non-existent. There are maybe 4 or 5 centers in all of China that provides rehabilitation, and we're struggling now to bring rehabilitation to our centers. However, in a few centers, they provide state-of-the-art rehabilitation that I think far exceeds anything in the U.S. And we can talk about that at another point. Chronic care is abysmal. There's no mechanism for chronic care. There's nobody to take care of the patients. So I have seen patients who are 4 or 5 years after injury still with a Foley catheter inside them, having repeated urinary tract infections, and then my telling the patients that if they don't change this, they will die. And then they go through the telephone with doctors in Hong Kong to find out how to do intermittent cath. I mean, this is how bad it can be. Things like neuropathic pain is treated with acupuncture and herbal medicines. It's a vale of tears in terms of chronic care in China, and this is something that needs to be addressed very seriously. Now, when I arrived there in 1999, there were all sorts of rumors of clinical trials of all sorts. I mean, people were saying, well, they're putting in fetal stem cells, doing this and that and that. I wasn't able to find any of it. It was actually very difficult to find. I can say now that I have visited over 100 hospitals myself. I've interviewed the doctors. I've talked to almost everybody involved. And there have been very few actual clinical trials. And the ones I list here are the ones that I've actually encountered. So, in terms of subacute therapies, this hospital in Jingzhou called the Henan People's Provincial Hospital has now done about 220 patients with bone marrow autografts, CD34+. Not enough recovery to write home to mom about, and I think they're stopping the trial. There's an incredible study that we're trying now to get published. I'm helping them publish this, and I've analyzed the data. I've examined all the patients. Really quite an impressive study. They're doing intramedullary decompression of the patients between 2 to 65 days after injury. They're doing what Reginald Allen did in 1911. You may recall he's a Philadelphia physician who took dogs, contused them, and then afterwards he cut open their spinal cord and washed the necrotic things out, and these dogs were much better. In Kunming, they have done 30 patients. Between 2 to 65 days after injury, all Asia A, complete spinal cord injuries, they would go in, open up the spinal cord, remove all adhesions, and then if they felt that the spinal cord was soft, necrotic underneath, they'll do a lateral myelotomy, which is, I think, the best approach. And they would wash the necrotic material out, and over 50% of the patients recover walking. Really impressive. They also showed that it is safe, but the one thing that they did show was that this kind of exposure of the spinal cord may have significant therapeutic effects, and this really brings up the issue of what should the proper control be in transplantation. In terms of chronic spinal cord injury, the therapy that has achieved the largest number of patients that have been used is olfactory and sheathing glial cells. These are obtained from fetal cells, and I'm just going to tell you a very quick story. I'm going to talk as quickly as I can, but a former postdoctoral fellow of mine who worked with me 1999 to 2001, isolating rat olfactory and sheathing glial cells from neonatal olfactory bulb, went back to China. He was at that time the head of the Naval Hospital neurosurgery, and this is 2001. He went back, and 9/11 was happening in the U.S. But anyway, on Christmas of 2001, he wrote me an email, and he said, "Wise, I just transplanted fetal olfactory and sheathing glial cells into 35 patients with spinal cord injury, and they seem to be recovering." I said, "Oh, you did what?" And he says, "Look, you know, the method that we use to grow the cells is the same that we use in the neonatal rats. You know, neonatal rats look like human fetuses, about the same size. The same method works." So the first time I went out there in April of 2002, I examined his patients. By that time, he had already done 160 patients. He I think was transplanting these cells into the patients. Up to 171 patients, he was exposing the injury site and just injecting the cells above and below the injury site and doing a wide laminectomy. After the first 171 patients, he went to mini laminectomies right around the injury site and just not even exposing the injury site, but injecting into the surrounding areas. And I confirmed at least 2 of his observations at that time. Number one, almost all the patients I saw had at least 4 to 8 dermatomes lowering of their sensory level, which was actually quite impressive, and this was occurring within 6 weeks after injury, after the surgery. I think this is a real phenomenon, that the sensory improvement is real, and I've seen enough of the patients to know that it probably is lasting. I've seen several patients that were 2, 3, 4 years after, and they still have that sensory improvement. I think the motor improvement has been